Look, I'd like to begin. I'm on the land of the Ngunnawal and the Ngambri peoples, and I acknowledge, pay my respects to them. And because I'm past district governor of District 9705 for the Wiradjuri, the Tarawal, the Gundagara, the Ngarigo and the Yuin peoples as well, but also to any Aboriginal people here with us, and also, of course, to any Indigenous peoples across Zone 8. My name's Michael Moore, and I'm facilitating today. I'm past president, apart from a past district governor of Rotary. I'm also a past president of the World Federation of Public Health Associations, and I'm currently a member of the Rotary Foundation's International COVID Task Force. I'll be speaking first, and I'll be followed by Andrea Grosvenor, who is Eastern Region Supervisor for Rotarians Against Malaria. She's been part of a team visiting places like Timor-Leste, Solomon Islands, and West Timor. Andrea will be talking about malaria as really following from my broader group. And then the other area we're going to be looking at will be introduced by past President Kerry Kornhauser from Melbourne. She'll be supported by Rob McKirk, who is also heavily involved in the End Trachoma program. Of course, trachoma, as I'm sure Kerry will explain, Australia is the only developed nation in the world where we have endemic trachoma. Kerry is also a founder of Women in Rotary. So I think, to put in context, it was Dr. Margaret Chan, as Director General of the World Health Organization, that pointed out the challenges facing public health in the broader context in which we struggle have simply become too numerous, too complex for a business as usual approach. And it is in that context that she asked my own organisation, the World Federation of Public Health Associations, to come up with a way of dealing broadly with health. And I'll come to that. But first, I want to talk a bit about the public health professional, because it puts things in context. We know firemen save lives, and paramedics and nurses and doctors all save lives. But when we talk about public health professionals, and I include Rotarians in this, we also save lives. The only difference is we do it at 1 million at a time. And I think it's now that we all understand what public health is, I think perhaps we understand that in particular. It's also interesting to me that we know, sorry about my screen. It's also interesting to me that it was only 2 years ago, I guess, that 120 of us or so in Canberra knew what an epidemiologist was, and now everybody's an absolute expert. And so we continue on with my screen. And so when Margaret Chan approached the World Federation of Public Health Associations, she asked us to try and frame in the global context how do we deal with health? What is the driver of health? And what is public health? Well, public health is about protection, prevention, and health promotion. That's the fundamentals, the three fundamentals that we talk about. And I'll come back to those in a moment. And the Millennium Development Goals, the Ottawa Charter, the Declaration of Alma Ata, these were fundamental to us. Then what we've got here are the 7 areas of action. And those 7 areas include, as I mentioned earlier, the protection, prevention, health promotion. But those enablers became fundamental to how you carry out or how you deal with public health. It requires good governance. It requires accurate information, effective advocacy, and capacity building. And all of these should sing to Rotarians. And for me, one of the joys of being in Rotary and also being in public health is that I see Rotary as a public health organisation. Next slide. But we also have the challenges of global health leadership. Next slide. Fit in with the Sustainable Development Goals. And it's interesting that the World Health Organization, when they explain the Sustainable Development Goals, they put at the very centre good health and well-being to ensure healthy lives and promote well-being for all ages. And once again, this will sing to Rotarians. And to me, the thing that's really interesting is that the Sustainable Development Goals and Rotary's areas of focus are very, very well aligned. So if you go to the next slide, we'll see that and keep going through those, please, Rob. So peace and conflict prevention, disease prevention and treatment, water and sanitation, maternal and child health, and basic education and literacy, economic and community development, and supporting the environment. These are all health issues. All of these are about making sure that we have a healthy community, healthy society, and healthy people. So it should be no surprise that the Global Charter for the Public's Health, the Sustainable Development Goals, and the areas of focus in Rotary is working in this way. So the next slide, please. So what are the Sustainable Development Goals? We'll run through these because you'll think about how the focus of areas of focus Rotary fit in with these. So no poverty, zero hunger, good health and well-being, quality education, gender equality, clean water and sanitation, affordable and clean energy, decent work, economic growth, industry innovation, infrastructure, reduced inequality, sustainable cities and communities, responsible consumption and production, climate action, life below the water and above the land, and peace and justice, strong institutions. And of course, in Rotary, we know that you achieve these things with partnership. Next, go please, Rob. And to me, the Sustainable Development Goals provide just a more specific understanding of those areas and what they are. Like our areas of focus, is the formula for a healthier world by 2030. And so for me, the role that Rotary played internationally in setting up the Sustainable Development Goals was fundamental. Next slide, please, Rob. And so I think that now having some specific examples from Andrea and then from Kerry with support from Rob McKirk will help get to where we need to be, and then open for discussion. I do see some things coming into chat, and I can now look at it, but actually it's all about trying to look after my screen. Let's see if Andrea can do better.
Okay, right. Well, thank you, Michael. And I would like to also acknowledge the traditional owners of the land on which we're meeting, and pay my respects to the elders past, present and emerging. Well, in 2019, there were 229 million new cases of malaria worldwide, with 409,000 deaths. Malaria is an enormous human, social and economic burden. The heaviest toll is among the poorest communities, mostly in Africa and other tropical regions, including our neighbourhood. But the good news is that since 2000, deaths from malaria have halved. According to the WHO, in the past 20 years, 1.5 billion cases and 7.6 million deaths have been averted. Nonetheless, since 2015, progress is at a standstill. Old tools remain effective, but new tools are desperately needed as we aspire to achieve the WHO 2030 target of reducing global malaria incidence and mortality rates by at least 90%. Today, I'll be briefly covering Rotary's work on malaria at a global level, Rotarians Against Malaria Australia's activities and plans in our region, and I'll touch briefly on vaccine research. In a YouTube post on the 1st of June this year titled Spearheading the Rotarian-Led Fight to End Malaria, past RI President K.R. Ravi Ravindran talked about his experience in his own country, Sri Lanka, where Rotarians led polio eradication. He noted that Rotarians have a demonstrated capacity to lead global-scale change. In 2020, Rotary International and the Rotary Foundation awarded the first program of scale $2 million US dollar award to the Rotarian-led Malaria Partners International, MPI, for a project to eliminate malaria in Zambia. MPI has partnered with World Vision and the Bill and Melinda Gates Foundation to garner an additional $4 million to the project. The project will train thousands of community health workers to test and treat local communities and will benefit around 1.3 million people. Past RI President Ravi believes that this can be a model for eliminating malaria in Zambia, which can be expanded for the rest of Africa and then the world. Rotarians Against Malaria, RAM, Australia. Rotarians in Australia established RAM in 1990 to end the scourge of malaria in Papua New Guinea and the Solomon Islands. Since then, RAM has coordinated Rotarian support to eliminate malaria in our partner countries. Rotarians have helped reduce malaria in Vanuatu, PNG, Solomon Islands, and Timor-Leste, and we're now starting new projects in West Timor, Indonesia. RAM is a national Rotary activity of RAWCS, Rotary Australia World Community Service. RAM is funded by donations from Rotary clubs, Rotarians, and individuals. Donations to RAM through RAWCS are tax deductible. RAM also receives project funding from district and global grants through the Rotary Foundation. RAM supports projects that aim to control and ultimately eliminate malaria. We work with Rotary clubs and government health programs in our partner countries and follow the recommended WHO guidelines on the best strategies for control and elimination of malaria. RAM's scientific committee keeps us abreast of latest research and development in Rotaria elimination. Most of our projects target vector control, that is, reducing the mosquito population and the opportunity for mosquitoes to bite humans and thus spread the malaria parasite. RAM funds the provision and distribution of long-lasting insecticide-treated bed nets, indoor residual spraying, and environmental improvements to destroy mosquito breeding sites. We fund the training of community health volunteers to participate in mass bed net distribution and malaria education, and we also support government health bodies to improve malaria surveillance. Let me give a few examples of RAM's work in our region. In Papua New Guinea, RAM Australia is a long-term supporter of RAM PNG's Chasing Malaria program, which aims to increase malaria education in selected primary schools via school malaria clubs. Children are sent out each week to look for mosquito breeding sites and destroy them where possible. The program also increases access to malaria services through services to local communities through the availability of school teachers who are trained in testing and treating malaria. The Chasing Malaria team supervises malaria medical facilities and provides training, diagnostic kits, and drugs. It also maps the incidence of malaria to identify hotspots for more intensive anti-malarial operations. RAM Australia has provided around 870,000 Australian dollars to the Chasing Malaria program since 2014. In 2006, Timor-Leste reported an estimated 223,000 Indigenous cases, that is locally transmitted cases of malaria. By 2016, with the help from the Global Fund, WHO, and RAM, cases were reduced to less than 100. Timor-Leste reported no Indigenous malaria cases from July 2017 until late 2020. Unfortunately, late last year, 3 cases were reported in the border enclave of Akusi. This demonstrates the need for a sustained effort, particularly at border areas. In 2018, through RAM, the Rotary Club of North Hobart, District 9830, received a US $251,000 global grant from the Rotary Foundation to support the Timor-Leste National Malaria Program. The project galvanised widespread Rotary support across Australia, with 15 Rotary districts and 15 Rotary clubs providing funding to the project. This grant, plus a smaller follow-up grant in 2021, funded 50,000 insecticidal nets for pregnant women, training for more than 100 community health workers, 80 sprayer machines, diagnosis and treatment supplies for health facilities, plus education and promotional materials. The global grant was revised this year to include provision of PPE for malaria workers so that they can continue their work during COVID. Across the border in West Timor, in Nusa Tenggara Timor, NTT province, Indonesia, the Provincial Health Office is partnering with RAM. A Rotary Global grant of US $125,000+ was awarded in May 2021 for a project in 3 border districts to support malaria surveillance by village malaria cadres, capacity building of cadres for early testing and treatment, and mosquito control. In addition, RAM is working with Cross-Sector Development Partnership Initiative, XSPI, the Asia Pacific Leaders Malaria Alliance, and the national malaria programs in both Indonesia and Timor-Leste to conduct a community assessment to understand the current malaria situation and needs in both NTT province and Timor-Leste. The outcome is a costed implementation plan to accelerate malaria elimination in both countries. RAM is now seeking an additional funding for the project, which around $43,000 via a Rotary Global grant. So if any clubs or districts would like to participate, and I'll be asking 9705 to look at this as well, in this or in any other RAM projects, please contact us. Vanuatu. Malaria-free is within reach. Vanuatu was recently included in the WHO E2025 target for malaria elimination. In 2020, jointly with New Zealand District 9910, RAM received a Rotary Foundation global grant of $110,000 for the End Malaria in Vanuatu for Good program. This program will train and equip a national indoor residual spraying team in hotspot locations in Malampa and Sanma provinces. However, implementation of this program, along with a RAM-funded household mapping project, has been delayed due to COVID-19 restrictions and health staff involvement in the rollout of COVID vaccinations. RAM Australia's southern region, nonetheless, is still happy to accept donations to help Vanuatu fund its priority activities in its national strategic plan. Now, you might have heard of the Adopt a Village program in the Solomon Islands, which supplied bed nets to whole villages. When the Global Fund took over national supply of nets, RAM turned the funds to provide tools to villages to enable them to keep their villages free of mosquito breeding areas. Working closely with RAM Solomon Islands and the Rotary Club of Honiara, RAM Australia provided tools to 160 villages from 2013 to 2017 for a cost of around 200,000 Australian dollars. The programs had mixed success, and RAM has paused further funding pending evaluation. But RAM Australia is currently working with RAM Solomon Islands, the Rotary Club of Honiara, and WHO on a pilot project to trial a surveillance model for active case detection of malaria in high transmission areas of Honiara. The project will involve teams going house to house. Patients with fever will be tested with rapid diagnostic tests, and positive cases will be treated with anti-malarial drugs. The project will also include education and training material. If the pilot is successful, it may be adopted as a model for other parts of the country and other countries in the region. RAM has also funded a PhD scholarship for Dr. Edgar Pollard from the Solomon Islands, who recently completed his PhD on mosquito behaviour at the Australian Institute for Tropical Health and Medicine at James Cook University in Cairns, Australia. As Edgar is now working for the WHO in the Solomon Islands and is a key contributor to developing the RAM project I've just mentioned. RAM is currently in discussions with James Cook University to support a PhD student from Papua New Guinea with a top-up scholarship for the final year of his study. Okay, RORCS and RAM have formed a strategic partnership with the Global Fund to accelerate malaria elimination in the Western Pacific Rim. This partnership will build on a fundraising campaign aiming to raise $12 million over a 5-year period to scale up support for malaria elimination programs in Papua New Guinea, Solomon Islands, and Vanuatu, and to prevent the re-establishment of the disease in Timor-Leste. The Finish the Fight campaign is targeting large corporate and individual philanthropic supporters. Our efforts to date through RAM are invaluable in addressing immediate malaria needs at the community level, and we have contributed to saving thousands of lives. We're not going to stop doing this, but as we have seen with Rotary's push in the global eradication of polio, it will take more than barbecues and mango drives to fully rid the world or even our region of malaria. We're calling on Rotary districts, clubs and Rotarians to use your networks and contacts to promote the Finish the Fight campaign so that we can reach the target of raising $12 million over 5 years. Finally, I want to briefly mention the malaria vaccine research. The Australia Malaria Vaccine Project is a project of Rotary District 9640. More than $1.2 million has been raised to support work on the malaria vaccine Plasprotect being undertaken at the Institute of Glycomics at Griffith University in Queensland. The project is one of the few in the world working on a whole parasite vaccine that targets the blood stage of the malaria parasite. Laboratory studies are showing promising results, and the plans for a phase 1 trial of this vaccine in 2022 are progressing well. This work has been made possible through the contribution of Rotarians. Of course, many labs around the world are working on malaria vaccines. The University of Oxford group that developed the AstraZeneca COVID-19 vaccine that many of us have received has developed a vaccine that has proved to be 77% effective in preventing malaria in children in a small early trial in Burkina Faso. Further trials are underway in several African countries. I'm not going to talk further about vaccines as I have no expertise in the area. Instead, I will recommend that you attend the Rotarians Against Malaria Virtual National Conference to be held on the 13th and 14th of November. The conference program includes expert speakers on a range of subjects that I've just skimmed the surface of today. You'll hear more about RAM's activities and also developments in malaria research and progress towards malaria elimination in our region. If last year's virtual conference is anything to go by, it will be a really interesting and informative event. And I can't finish without mentioning the Finish the Fight Congress on Malaria to be held immediately prior to the RI convention in Melbourne in May 2023. Despite the world's attention being focused on COVID, Rotary's malaria work not only continues, but is ramping up. Thank you for your interest today.
Thanks very much. Thanks very much, Andrea. It's greatly appreciated. And thank you. And for those who are technically inclined, the only problem I had was I shared the wrong screen. So let's move on now, please, to Kerry Kornhauser, who will talk about ending trachoma.
Thank you, Michael. Welcome, everybody. Rob McGuirk and I, co-directors on the End Trachoma project, are going to take you through our project. We acknowledge the traditional custodians of the land on which we meet today and pay our respects to their elders, past, present, and emerging. In the early days of our project, Rob and I were at a meeting with some elders, and one of the elders stood up and he said, "We have the right not to go blind." And you know what? They do have that right. Next slide, thanks. So what is trachoma? Trachoma is, trachoma is a eye disease that if you take it and get it enough times, you can go blind. You can see in the top slide how the lashes go inside and scratch the eye. It's very, very painful. There, you can see here the normal vision and the vision with trachoma, so it's very blurry. It's a bit like my background. Okay, so next slide, thanks. So where is it? As Michael had said, Australia is the only developed country that still has trachoma. It's appalling, absolutely. Even Mexico got rid of it just recently. Next slide. So where is it in Australia? In the olden days, it used to be everywhere. The Eye and Ear Hospital that was built in Melbourne was built for trachoma, but many of the cities and all the cities managed to get rid of it. It's now in this central Australia in the desert areas where it's very arid. Next slide, please. So the World Health Organization, they set up a strategy a safe strategy. So it was surgery, antibiotics, facial cleanliness, and environmental cleanliness. So the government and the medicos look after the surgery and the antibiotics. But who is going to look after the facial cleanliness and environmental cleanliness? So we put up our hand together with some other organisations and we work together. Next slide. So our project goal is to assist with the prevention of trachoma and other infectious diseases by enabling communities to practice good hygiene. Next slide. So we've had many, many projects over the years, and some have been more successful than others. And I'm going to just show you and introduce you to some of our projects. We introduced portable washing machines. These are little washing machines that you take when you go camping. And we got them all painted up and they were quite successful, except the lids kept on breaking. Soap making workshops. These were really great. The women really enjoyed the fact that they were making soap, but learning about hygiene and cleanliness and what soap can actually do. So these were great. We then did washes for face cleaning. So we gave each child 2 or 3 of these washes, all the same, their own, the same colour, with their names on them, and the school would wash them. So this would stop being the contamination. Next slide, thanks. And then we were at another meeting, and at that meeting, someone got up and said, we need mirrors. And we just looked at each other, mirrors? Oh my God, what's mirrors? And what they said was that they were getting huge, big mirrors, and the time the maintenance man came, 3, 6, even 9 months later to hang these mirrors, they'd fallen, they'd broken. So we said, why don't we have little tiles? So we trotted off to Bunnings and they became our partners. And we've given them over 8,000 mirrors, which has been fabulous. And we also introduced towel hooks because what was happening was the towels weren't getting dry. And those cold mornings, it's a bit hard to wipe yourself after a shower. And then just recently we received a phone call from one of the communities saying we need more mirrors. We said, why? And what's happened was that the kids were taking the mirrors out of the bathroom and putting them into their bedrooms and looking at them to look at themselves. So we were so delighted that they're actually taking interest in their own presentation. So obviously we gave them more mirrors. So the mirrors are doing really well. Next slide, thanks. Another promotion that we did was at Santa Teresa, which I went to that promotion, and we installed a community laundry of 2 machines, which the nurses station looks after, and a health promotion of teaching the children about disease and germs. And there were lots of different people from all the organisations there, and we were all about water. The kids loved it. It was a fabulous day. Next slide, thanks. And then we also provided little water basins in some of the communities there, as you can see. So there was fresh water to wash their hands, wash their faces, and have fresh drinking water. So this project took a long time because we had to coordinate with all the elders, with the community, with the council. It's strange how little projects can take so long. Next one, thanks. WA have been really proactive and we've been very supportive of them. And then they came up with this idea that they needed some bath towels because the towels that the people had were very thin towels and they had holes in them and weren't any good. So we supplied 10,000 towels. It took a long time to try and find where we could actually get them, but Sandy Fulcher, our administrator, sourced it and we found 10,000 towels and 3,000 towel hooks. So hang these up. This was a huge project, lots of packing and distributing, but it was fabulous. It's a really great project. Next one, thanks. So when Rob and Leanne were out in the desert looking at the project and they were going to communities, they noticed that it was really very no water and we needed to get water to these communities. How do you do that? So this is how these happen, the trailers and the portable water tanks. We created these and you can see these are 4 different ones that we've done and they've been really, really successful. The next slide, thanks. And then WA came up with an idea of a laundry trailer. So we went back there and we organised that. And this laundry trailer has been really fabulous. It's gone to a whole big section where the people can actually wash all their clothes and help more cleanliness, which is great. Next. And this is our latest one, is toiletry kits for schools. And this is a winner. Over 2,000 toiletry kits. It's just fabulous. It's priceless. We have the same contents in each each bag, and the bags are all done creatively. And there you can see some of the children really happy. And next one. So what we do, this is Rotary at work at its best. Each club does their own, sources their own contents, which will give them a list of the contents that needs to be done. They design, then create their own bags. They make up the kits, and then they pack and we ship them off. So we've had community groups help, Rotary clubs and Girl Guides, all helping do that. And the good thing about what this project has done, it's opened up a communication with the clubs, with the local Indigenous schools. And the kids have really, really enjoyed being part of that. And now a lot of clubs are actually getting more projects to do with their communities, which is fabulous. Next slide, thanks. And there we can see the end result, kids with the kits. Isn't it a fabulous photo? There's so many happy faces and so many creative bags. It's really, really wonderful. And so then we received all these letters, which has just been terrific. So we know that we're on the right track here. The schools are happy. Rotary clubs are happy. We're all happy. So this is fabulous. Next, thanks. So where we are now for 2021, which has been a bit of a struggle because of COVID, obviously, we've gone into partnership with the Environmental Health Officer to find an Environmental Health Officer, and they're doing some research on how to make the houses more sustainable, cleaner, more fresher running water. So this will take a year and a half to do this project. And we have sourced some more schools, and we have sourced some more Rotary clubs, another 1,000 toiletry kits. So if you know anyone who wants to do toiletry kits, let us know. And WA, as I said, were very proactive. They've actually come back to us and asked for another washer dryer because it is so successful. And so we've organised for them to get that project. And now I'll introduce you to Rob McWork, who is going to take over for the next part of the presentation.
Thanks very much, Kerry. So, having seen what's been done, I was just going to outline how the project was created, some of the challenges and some of the solutions we came up with, and some of the outcomes. So the initial challenge came about in 2015. I was chair of the Indigenous Programs Committee at Rotary Melbourne, and the idea was to create a national project to celebrate our 100th anniversary. So knowing that the Indigenous are amongst the least advantaged Australians, trachoma is only a problem in Indigenous communities, and with WHO's target to eliminate it globally by 2020, it seemed to be a very logical fit that this could become a national project. We were fortunate enough to have as a honorary member of the Rotary Melbourne Club, Professor Hugh Taylor, who's an world expert in trachoma. And so consulting with him, we came up with the idea for this project. Next slide, thanks. So what were some of the major challenges was, because we knew this was going to be a project for over 5 years, we had to work out how we're going to manage this. Again, it needs some stable governance and organisation to be able to do it. And how would we fund the expenses? Because we know inevitably there's some expenses, and raise funds. And how would we try to engage clubs from all around Australia? Next slide, thanks. So solutions we came up with, there's a company we registered called Nourish Our Communities Limited, and we registered that as a charity. We also registered for fundraising, and we got DGR status for it as well. So of course the donations will be tax deductible. We had a small group of project directors who've been with us since the start, and we've had one join us halfway through the project. We went to foundations to get the funds we needed for the administration and management, because what we wanted to do is when we went to the Rotary clubs, we want to say to them, hand on heart, we will raise whatever funds we raise, we will put into projects. It's not going to go to any of the costs of the projects. So fortunately, we had the Baker Foundation, who'd funded several things previously. We approached them, and the Rotary Club of Melbourne provided the seed funding for the first year. And then the next 2 years, we had Rotary Club of Hall provided us the funding to match the foundation funds to fund the admin. We then also had to develop relationships with partner organisations, because we were there to obviously try and assist. We're not the experts on the ground. And again, in the interest of good governance, I arranged for pro bono solicitors, which was K&L Gates, a national firm, William Buck, a national firm of accountants, and I must also acknowledge Kian Tay, who's been our auditor for the last 4 years, who's all been very generous in giving us their time pro bono. So as far as Rotary was concerned, having a clear goal, it's a 2020 end trachoma, that's the WHO's deadline. It's like polio, you know, people can understand it, get their head around it. That's what we're trying to do. So it had a clear purpose. We got the district endorsement from District 9800 because it was to be a national project. We wanted to make sure it was not just a club, it was through that district and through to the other districts. We also were fortunate because that was the time when he was president-elect at the time, international president-elect Ian Risley, who we obtained his support, and he endorsed us and produced a video for us in the early days to create the awareness. And we also have to acknowledge the great work of Noel Travascus, who was our zone director at the time, who was very supportive to make sure we could get a national platform to promote this as well. And last but not least, of course, the district champions, because we had to work out how we would reach through to all of the different clubs. And so we came up with the idea of the district champions who would each take on that role over the period. Next slide, thanks. So the project team, we were really fortunate to get Leanne Trin as our project manager. She is an optometrist. She was also a Rotary Foundation scholar. She'd worked in remote Indigenous communities, both in Australia and in Vietnam. And she was our project manager for 5 years. She committed to the 5 years, and she's now moved on though, but working with the Brian Holden Vision Institute in Darwin. She's moved up to there. And we were fortunate to get Sandy Fulcher to do our admin and support, because there's a lot of coordination with dealing with the clubs and the district champions and the meetings. And we've been doing Zoom meetings for the last 4 years, I think it is now, since we started Zooming with our district champions, so before COVID hit. So there's a lot of coordination. And then again, Kerry, myself and Murray, past District Governor Murray Verso, who came on board, and he's been a great boon to us as well. So it's a really good, solid team we've had and still have. Next slide, thanks. Again, can't thank enough our district champions. Some have come and gone over the period, but I must say over the 4 and a bit years we've been running with them now, it's amazing just the level of enthusiasm, their persistence, and the great work that's been done in promoting this project throughout their districts, and also turning up. We've had monthly meetings over the last few years, and then turning up regularly to provide input into the project. That's been really great. Next, of course, next slide. We work with many partner organisations, both government, non-government, and also corporate. As Kerry pointed out before, Bunnings were very generous in, we bought a lot of mirrors, but they also donated them. We've had Sukin, who's not there, but they donated some of the toiletry products for us. Wateryard is a vineyard who used their wine sales for fundraising, and Cedar Summit providing some of the chamois that we saw earlier on. Thanks. Next slide. So again, the idea, there's several peak bodies, of course. WA is very proactive. They're the ones who we worked on with the laundry trailer and the towels particularly. So we've been involved with them, and they've released a book about some of their trachoma stories, and Rotary features prominently in that book about the work that we've done with them. Northern Territory Trachoma Group as well, we've been meeting regularly with them. Leanne used to attend those meetings regularly, and I've taken over attending those meetings with Sandy. And it's Australian Trachoma Alliance, we were a member of that for several years, which was the peak body chaired by Major General Michael Jeffrey, previous Governor General, who unfortunately passed away in December. But being part of those organisations just was great to further the work and make the connections. Next slide, thanks. So successes to date. The overall prevalence of trachoma is decreasing. It's not eliminated yet. There are less at-risk communities as well. And in general, there's a greater understanding in communities about the importance of environmental health. Now, of course, in recent times, that's also been accelerated because with the same sort of things that apply to any trachoma is clean faces, clean hands are all COVID as well. So COVID has come in with put an extra boost into the importance of environmental health, fresh water, clean water, and cleanliness and hand washing. So it's added to the work. So in my meeting, which I had just this week with the Northern Territory Trachoma Group, the latest sets of statistics look they will be significantly better. So for a while, progress was just going along quietly, but it looks like there could be some significant progress, which won't come out for another year or so when the figures are collated. As far as Rotary is concerned, increased awareness of Indigenous health issues. Again, I knew very little about trachoma and the problems of Indigenous health within the communities. There are other issues, scabies, rheumatic heart. These sort of diseases all rely on a good, clean environment. They can be removed with proper environmental health issues, being people being aware of it, but also having the means to have clean hands, which means you need the water, you need the infrastructure to be able to maintain those healthy environments. Again, we found there's a greater interest generally in Indigenous issues, which is great in terms of raising our profile. And again, there's more projects, there's other projects we're working on in terms of that as well. We've raised over 1.1 million and have had over 300 clubs participate, which is, we think, has been a fantastic achievement. Clubs from all around Australia. And again, with the district champions, they've been a successful model that could potentially be used for other purposes and other projects. Next slide, thanks. But again, it's not over.
I'm going to ask you to be very quick. I do want to get to the question and the answers.
Sure. Okay, second last slide. More needs to be done. The goal has been moved. The WHO has extended their goal, but we do need to commit to it further. So last slide. Thanks. And I'd just like to say it takes, as the famous saying goes, it takes a village to raise a child. This Rotary project has taken a great team, the district champions, the clubs, supporters and the other organisations to get behind it. And it's been a fantastic project to be involved in. That's it. Thank you.
Thanks very much, Kerry and Rob. It's absolutely fantastic. I'd like to now open to questions, and you can either put them on the chat if you prefer, or raise your hand. You can use the reaction device if you like to raise your hand, but I am watching to see if there are any questions or comments if you would like to make them. And at the moment, I don't see any. So,
Graham,
do you see one? There's going, Graham. Thanks.
Yeah. I'd just like, first of all, to say thank you to Anne for talking about the malaria vaccine project. I actually chair that program, and also to all the people present, because we've now raised 1.3 million. And I guess my question, to Anne and others is, I think it's a most important time for all of us that are involved in the elimination and the prevention of malaria, that, we work together in this period of time, because World Health is expecting the deaths from malaria to be even worse than the 409 million during the COVID time, because people are not getting to clinics. So I just wondered, Andrea, whether you had any reaction to that. But thank you, everybody, for your help for the malaria vaccine project. Professor Good's a bit further along than Andrea said, but, we're on the right track.
Andrea?
Oh, look, thanks very much for that. As I said, I'm not an expert, not my field. And I was lifting material from the Vaccine Project's latest newsletter that I had access to. So appreciate that. Absolutely. And I think it's important that while the world is looking at COVID, that we just can't afford to drop the ball on malaria. And we certainly, through RAM Australia and our partners in the region, we're trying not to. We've had a slight handicap with some projects where the health department people that we work with in Timor-Leste, West Timor, wherever, are being taken off of the malaria program work onto COVID. But we're trying to, keep the momentum on malaria. No, I just totally agree. We do have to keep working, and it would be really great to see. One of the things RAM is trying to do is to get RI to focus on malaria as its next major project after polio.
A program of scale grant would be wonderful for something like a malaria vaccine. Of course, it's not exactly on their wavelength, but thank you.
Yeah, and it's the Finish the Fight campaign is also an important part of that.
Thank you, mate. I am watching for other questions. I will just clarify, it's 4.5 million deaths that we've had from COVID. 19 at the moment. And I'm just checking. Can I see any other hand or comment if you like? Greg, please.
Yes, I just would like to say, in terms of the programs we've heard today, I really encourage that Rotary clubs and districts promote Rotary programs, and that's what we've been doing today, which I think is fantastic. I've obviously got a vested interest with Australian Rotary Health. It's 40 years old now, and it started, and we saved millions of lives with the sudden infant death syndrome, the research into that, but it was a Rotary-driven program, and the work on mental health since 2000 has been outstanding. Again, it's a Rotary-driven program, so I just encourage everyone to keep doing the things that we actually promote and we create ourselves.
Yeah. And Greg, of course, Australian Rotary Health is focused very heavily on mental health at the moment, and in this time of COVID-19, of course, that has become more and more significant. I see a question on the chat, and I'll come to that, but I'm just going to see if there's somebody who's live first for another question or a comment. Andrew, the question for you really is there any overlap between the mosquito-borne disease like malaria and also dengue and so forth? I'll leave that one with you.
Look, thanks, Michael. Yeah, different mosquitoes. My brief experience is that dengue mosquitoes bite during the day and tend to be in cities. The malaria mosquitoes bite sunset and after dark and are in more swampy areas. Look, can I pass to Jenny Kerrison, who I see has her hand up, who is the National Manager of RAM Australia, and she might be able to possibly, I mean, the short answer is if you can get rid of mosquitoes, you can do things with both diseases, but they are different mosquitoes with different characteristics.
And that might have an environmental impact too. Jenny.
Absolutely.
Thank you, Michael and Andrea. That was a great presentation, Andrea. Very well. You've spoken about RAM activities and what we've done over the many years. Firstly, I'd like to perhaps mention Graham Jones, PDG Graham Jones, in terms of, how we're going to prevent deaths in view of COVID. WHO has, and this morning, the polio speaker, I'm sorry, I forgot her name. She talked about, Anne Lee.
Anne Lee, yeah.
Yeah, she spoke about integrated health, and that is what WHO is hoping to do. Vaccine is a little bit away. Maybe mRNA vaccine will come forth before Plus Protect. We don't know. They work differently. We appreciate that, and need a lot more money than mango drives and barbecues. But I think, yes, that integration with clean water, climate change, I think that education, the public health approach, protection, prevention, promotion, critical. And that's what we have. The tools we have now we can use. Bed nets, indoor residual spraying. Let's do that until we can find greater ways of preventing and more permanent ways of preventing. I think we need to prevent the death totally. Now,
thanks, I am very conscious of time because we only got 3 or 4 minutes. I've got one more question. I'll give you just a chance to make your final point. Right.
I guess, that is the point. We need to look at public health approach, do what we can until we have greater tools ahead of us. Thank you.
It's great for Rotary, isn't it? Prevention, protection, health promotion. It explains it. But for Kerry, for you and Rob, how's the program being impacted upon by COVID-19?
Well, it's been a bit more restricted because we can't get out to the communities, but in Alice Springs, but they are working together, trying to get out there. Would you say, Rob? I don't think it's much. The cleanliness has been a really good thing. That's worked really well because people are so much more into cleaning their hands and their faces. That's gone into the communities. Rob, would you say anything?
Yeah. Some of the things have been delayed. You saw there was an East Space project, which we did at Tichikala, which was infrastructure. There were 2 other communities we were supposed to go to. They've been delayed because, again, of the lockdowns in communities. But as Kerry said, and as was mentioned at the NT working group, the emphasis on cleanliness with COVID and the hand washing has actually boosted the end results. So it's a bit of a win and a lose, but basically it's heading in the right direction, though.
I'd like to thank you all for being here. I'd like to thank our speakers in particular, Andrea, Kerry and Rob, and for all of you for participating. And I think the most important thing is that from each of these examples, there are lessons that apply right across what Rotarians do and what projects we have around disease prevention, but of course it's much broader than just disease prevention, and that's why we talk about protection, prevention, and health promotion. So thank you very much, and I'm going to use this opportunity to give Greg one final chance. Oh, he's waving goodbye. It's excellent.
Michael, can I just answer Josie's question? Josie, how can their club be involved? Give us a call because definitely with the kids, clubs are loving it, and that's really working really, really well. So you've got my number. Call me.
There we are. Or go through your club, Kerry, which is the Rotary Club of Albert Park. Am I right?
Melbourne.
Rotary Club of Melbourne. Okay. And you can always find us through the zone anyway.
Yeah.
Thanks everybody. Thanks for being here, and I really appreciate it. Let's see what we can do to prevent disease and keep people healthy.